All right, thank you so much for staying with Citizen TV. Let's delve into this issue of COVID-19 for a bit. It's still ravaging the country. The death toll is still increasing. The positivity rate is also increasing. There's been a bit of escalation of the COVID-19 regulations. Let's see whether these are the best options now. Joining me now is Dr. Alfred Mutua. He's the Machakos governor. Thank you so much for joining us online. We also have Senator Kimani Wamatangi, Kiambu Senator, is also joining us online as well. And Dr. Moses Masika, who's a virologist, is also joining us online. And Dr. Mutua, I'll start with you on this because I saw you at State House yesterday. What options were you mulling with the president before you came up with this line of COVID-19 regulations?
I think it was very clear that the country is in deep trouble. We've got counties such as Nakuru. We've got some counties that are getting overwhelmed by the large number of people who are infected. And not only infected, but who are very symptomatic and actually very, very sick. And the report from all the counties is very clear that all of a sudden we went from basically zero. For example, in Machakos, we are mulling over, shutting down our remote field hospital. Our ICUs were empty. There were no people in isolation. Now, as we speak, I've got 12 people in ICU, very, very serious. I've got more people going into the isolation who are symptomatic because, people who are not symptomatic are staying at home. But now we're getting cases where people are actually sick and require medical help. So the conversation was around what has really caused this. And it was basically came down to lifestyle. You see some counties, people don't even wear masks. I was in a county the other day around to say, and I counted 10 people. Out of 10, 8 were wearing masks. 2 were wearing masks. And out of the 2, the mask was not even covering the face. It was on the, on the chin. So basically it was just zero compliance. We see the churches now, you see all the big groupings, people are going to church, they're singing the keshas, and they're singing loudly. You look at political meetings, rallies, people are coming together, people are not wearing masks. And then you look at the opening of bars and restaurants. There was a story that was being told yesterday about you going to a pub in one of the cities in Kenya, and people are just sitting next to each other. You'd think they're all married to each other. Small tables, beer on the table, they're all shouting, they're all drunk, nobody's wearing a mask, there's no distance spacing. So we have basically brought this upon ourselves. Yeah. And so the question was, do we lock the country or not? Do we bring the curfew there was a suggestion to bring the curfew to 7 p.m. to the way it used to be. There's a question about locking some counties. But then the question came in, then how do we survive? Because we are in an economy that was not prepared to receive the shock. Because for quite some years now, and Senator Matangi will bear me witness, some people are supposed to be helping drive the economic car, were busy campaigning, so we're in deep economic trouble right now. So we had to come to a kind of a balance, say, let's take it back, let's push the curfew, let's get enforcement back properly, and let's watch. Within the next 2 to 3 weeks, a decision will be made, and then counties can start being locked up according to the way the cases are rising in those counties.
So, Dr. Mutua, there's a chance of a complete lockdown then?
There's a chance of a complete lockdown. I mean, the president was very clear on this. The health officials were very clear on this. And the problem we are seeing is that our death rate has jumped from 1.7 to 1.9, and it's rising. This is what it means. It means that before, if people got sick, a certain percentage died, others were cured. Now we are getting more people dying than before. We don't know whether it's a different strain. Maybe Dr. will tell us or what is happening. Because if this continues, it means that if people are getting sick, more people will die. Yeah. And then we're in deep trouble as a country because it means you get sick, you die. Before you get sick, you get healed. So we are really worried and scared about this. And it seems to be bringing out conversation. The president was telling us yesterday that, you remember there was that very funny meme video that says, do you know somebody who knows somebody who knows somebody who knows somebody who has corona? And people would say no. Now the question is no longer do you know somebody who has corona, is how many people do you know who have died of corona? Yeah. We've all been touched by COVID-19.
Okay. Dr. Masika, are these measures enough?
Well, I think they are well balanced because, as you say, we are protecting lives and also protecting livelihoods. But I think one of the things that I would like to emphasize to our nation is that the fight is now in the counties. previously in September, we had some counties even questioning the investments they had made, silently, of course, in the healthcare to fight COVID because they were not in use. But right now, there's a question as to whether we need to invest more. There's no question as to whether we need to invest more, but also invest in educating the masses. If you go through most counties, you'll find that public service vehicles are not as overloaded, not as empty as in Nairobi, half empty as in Nairobi. You'll find that masks are not in use in most places outside the major cities, and there is also the what I would call innocuous, or what people would consider less risky gatherings within the families, where somebody has a birthday party, somebody has a wedding event or pre-wedding event, somebody has visiting relatives, and those meetings are actually fueling the pandemic. This had been stopped before because people were concerned, but right now people had started those meetings again. So I think the measures that were put were well balanced in my view, but we need to emphasize to our citizens in the counties that the fight is here with us. It's not just in Nairobi and Mombasa, it is everywhere.
Dr.
Yes,
Masika,
and that's where
is this a more virulent virus now, or is it just an increase in infections?
I don't think it is necessarily a more virulent strain. We don't have evidence for that. What I can say is that as the numbers go up, then you're more likely to see more deaths. For example, the percentages that the governor gave from 1.6 to 1.9, it means out of 1,000 people, we were losing 16. Now, if you have 1,000 COVID patients, you're losing 19. This could be because there are more people who are sick, meaning some of them will stay home until it's very late before they can go to hospital. And also in hospital, the resources are getting stretched. So somebody who would have oxygen may not have it as early as they require it because there's somebody else on the oxygen bed. And this affects our ability to serve the sick because you are now overwhelming or stretching the health systems. And if you do not have that balance of the cases so that everybody gets a bed and gets oxygen and gets good service, then you end up losing people who should not have died because they were not helped in time.
Okay. Senator Wamatangi, when the COG says that they have about 11 counties which have less than 5 ICU beds, and we know the kind of investment that went into the preparation for COVID-19, have we failed Kenyans, or is it just individual counties failing? I know you can specifically speak about Kiambu, but have they done enough in terms of preparation?
Trevor, let me first begin by acknowledging most of the things that have been said by my two counterparts in this discussion are quite right. And to me, Trevor, first I think where we have to begin right now, after all you've explained now, is we have to be more decisive. We have to be more decisive. We have to decide what are our priorities for that matter. And remember, we touched on this last time in our discussion, because you see, if we wait between how much are we intending, or are we ready to lose or to sacrifice in terms of economic activities, continuing with our ordinary social lives, and how much we are losing if we allow the pandemic to continue at the speed at which it has taken on now. We have to make decisions, Trevor, as a country, and decide, do we want to wait for the aftermath of this? And, interesting enough is we are not short of examples of what has happened in other countries, save for Tanzania, which unfortunately seems to have been putting undue pressure on us as a country to almost want to look similar. Because if you listen to many people, and even people who have been given the responsibility, they'll be talking about, how is Tanzania doing this? And this has even seeped into the minds of the citizenry. Secondly, Trevor, we have a challenge with enforcement. And like you said, the measures may be balanced now, but are they being enforced? Remember, the first time, you would see policemen going to bars, you would see enforcement of the regulation on public service transport, and so on. Now, where do you see it? And so, because as they say, fish starts rotting from the head. If those that have been given the responsibility of enforcement do not carry it out, And agreeing with what Dr. Mutua said earlier, that the worst culprits are political leaders in the first place, because we've set bad examples. Remember when there was a bit of discussion, has the money about COVID been misappropriated? This took a political cue, and there was quite a bit of politicking. That is when citizens dropped their masks. They started asking, you mean this thing was like this? Oh, you mean it was like this? It was all about making money. And I think we have to ensure that, one, we have correct enforcement and proper civic education. People must get to understand this. And let government come out clearly. Let them inculcate in people's minds once more that definitely we have to take a different look at that. Now, lastly, is on what you've asked about our counties. Have they underinvested? Have they done what they should do? And in my view, because I've been monitoring even what has been happening in my own county, yes, some governors have tried. Some have tried and done the best that they could, given the challenges that have been there, including in financing and so on. But a lot, much more could be done if, in the first place, we had taken this issue as seriously as we should. I just want to draw an example, Trevor, as I finish my point. Look at, for example, how a country like Hong Kong handled COVID. When COVID struck them, they formed whatever what we would call their regulations. They were enforced and accepted by the citizenry consistently. And that's the key word, consistently. And it became a norm, such that now when you go into the supermarket, you go wherever, for all those months, almost a year plus, it is no longer a question of whether you'll see somebody wearing a mask. It is the daily thing to do. It is part of dress code. And unless we go that way, we are going to have to face a big upheaval, and especially even what we are trying to save economically. There are countries that you've seen that have opened, lockdown quickly, and much to their devastation. You can imagine right now what is going on in the mind of a young student who is sitting in a class after hearing that so many teachers died, so many are infected, and yet we have our children sitting in schools. So unless we really make serious policy decisions on how we are going to go about this, I believe we would continue to have an issue.
All right, Governor Mutua, what was the reasoning of keeping the schools open and also insisting that the rest of the schools going children will come back in January, knowing all too well that there are some schools that have now already shut because of COVID-19?
I think it comes down to three things, and Dr. will bear me witness. The first one is that, first of all, the children, even when they get infected, they are not badly off compared to adults. Maybe this has to do with Kenya is leading in terms of vaccination, so our children seems to have a booster against getting infected and getting infected against dying. Maybe that's one of the scenarios. Number two is that life has to continue somewhat, because we are looking at the negative impact of children staying at home. If you look at the United Nations data about children who go to school, the country is losing about $4,000 per month per child in terms of economic growth by keeping that child at home, by lack of education. Then you're looking at other problems. You're looking at high incidences of HIV are starting to rise among our young people. You're looking at incidences of pregnancy. You're looking at truancy. So you're looking at family issues at home, the cost that is borne by parents now who have to hire somebody with their meager income to take care of their children. So there are all these aspects that say, yes, we have to find a balance. We can't shut down schools for another 1 year. Kids have been at home for nearly a year now. They need to go back to school. That's why the president said, we can't, as governments, by ourselves, be able to take care of our children. It has to be a personal responsibility. We are asking our members of parliament, use your CDF to buy masks for your schools. That CDF money is enough to buy enough masks for a child, or basically one per week per child for every school in a constituency. We use all the monies that we have in various forms, in private sector, to buy masks for our children. We go through the protocols and we're able to educate our children. But this is on the hope that we'll be able to come down to a positivity rate of 3 to 4 to 5% by the end of this month. and at least by end of December, so that by January, things are a bit better.
And Governor, when they say that public officers beyond 58 years old should work remotely, what kind of an impact would that have in terms of human resources, even in a county like yours? When you send off the workforce that is 58 and beyond, how will that impact operations?
It will impact operations in the sense that by the time a lot of these people are 58 and above, they are the ones in upper management. That means they're the ones who need to sign the tender, they're the ones who need to sign the order, they're the ones who sign the HR, permission slip and everything. That means they'll not be able in a position to do that. So we also have to get creative in terms of how do you approve documents when you are remote. So you can't say you have to wait until you are given those documents. And the reason we're keeping the 58 plus at home is because they are more at risk. Because when you get older, you are more susceptible to other, especially lifestyle diseases. Your heart is weaker, your blood pressure starts acting up, you have issues of diabetes, you have other conditions. So it is basically protecting our loved ones whose immunity is a bit lower than people who are younger. So it's going to impact, but the point is we have to get creative as government. We have to be more relaxed. The agencies involved in oversighting have to be more relaxed and realize that things have to be done differently. You can't start arresting somebody and saying, "This document was not approved by signature." It can be approved in another way. So we'll have to get creative. Otherwise, the economy will actually slow down even further because it will mean that permits will not be given for building permits. It will mean that title deeds will not be issued. It will mean that bank credit will not be accessible, which now slows down the economy, which will make work even harder.
Yeah. Dr. Masika, what are we learning about this virus now? Because many people are calling it a second wave. Is it a second wave? Is it a spike? What's going on?
I think the biggest lesson is that the simplest measures are working. We saw when Kenya was in the initial wave that we made quite a bit of sacrifice, that people stayed home as much as possible. We wore our masks. We ensured social distancing even within matatus and other public service vehicles. And the minute we started to lift those measures, we saw a second wave, not just in Kenya, but in many places. And this, I think, is a good lesson because the measures that are working are not the most expensive. And that's why they're even able to work in countries in the developing world that do not have as much resources. But that if we slacken and just reduce our sense of vigilance, then we can see the infection coming back in a big way. And that, I think, is a bitter lesson, but it's the truth. Other things that are being worked on include vaccines and some of the medications that have been touted in the past. But I think the biggest lesson is that the simplest of measures, if we follow them, will help us win this war. And we really don't have much of an option if we want to ride the wave as soon as possible. But to keep vigilant, and as Senator Matangi said, enforce from the top to the bottom the measures that we put in place.
But Dr. Masika,
let me jump in here, if you allow me.
Because
in terms of enforcing, Senator Matangi talked about Hong Kong. We have to realize that Hong Kong, China, those countries have had a history. They had the SARS, they have all these outbreaks, so they're used to wearing masks as a matter of course. It is new here in Kenya. And then it gets complicated because in Kenya, we are saying wear masks. Politicians are supposed to wear masks. So when we see the deputy president, for example, going out to functions, to a church function, him and his troop of sycophantic followers not wearing masks in a church, in a public gathering. What does that tell a young person? What does that tell a mama who is sitting across? If the deputy president of the Republic of Kenya is not wearing a mask, it means there's nothing to worry about. It means that hii kitu hakuna, hii ni story, ni propaganda. So people don't dare. And I watched a clip whereby the deputy president was in a queue shaking hands. And he's actually shaking hands, actually making contact. And that's one of the ways of spreading the germs. And down the queue, you can see people wearing masks. When he gets close to them, he shakes their hand. As he moves to the next person, the one who was behind, wanatoa mask zao. They copy, they mimic. Because the deputy president is not wearing a mask, then why am I wearing a mask? Because we're all wearing a mask because the deputy president is coming. You need to conform to regulations set by the government that the deputy president serves in. So we've got this recklessness, this don't care attitude in our leadership that has actually led to the deaths that are happening today. And so we have to take responsibility as politicians, as leaders. I am also responsible. I had my listening tours, I have to admit. I went to these communities. I was wearing my mask anytime I got near people. I made sure that I told people, stay away from me, wear your mask in our meetings. But I realized by virtue of just being in those meetings, people conglomerate. Even if you told them to stay apart, they will still come together. That is why I was the first one to say I'm suspending my listening tours, because I realized I was actually endangering others, even though I was trying to show them that I was behaving appropriately by wearing masks, by sanitizing in front of them. Yeah. But then I was playing my responsibility. But then I realized I was also not being very responsible, because I was creating an environment where people are falling in. And lastly, enforcement. We were joking yesterday at State House. You know, the police even have a pay bill now. You are stopped by the police at midnight or 1 o'clock. They know that if you don't have cash, if you send them M-Pesa, they can be investigated. They have set up a pay bill. Unatuma kwa pay bill, unaonyesha imeingia, anakuacha unaendelea. That's the level of corruption we've come into this country, where enforcement is either here or there. I had a friend of mine who was telling me that if you go to now the middle-class suburbs and upper-class suburbs of Lavington, Kileleshwa, Keren, there you're stopped by police. But the bars are open in Buruburu, they are open in Kayole, in Nairobi, they are open in the suburbs, in most of the counties. They are open until morning, and nothing is done. So enforcement, it has to come to if the police are not able to do it, then let the president roll out the military. Let the military come out and go bar to bar and shut them down without any fear or favor. Because at the end of the day, these are people who are dying, and we have to be a country of discipline.
Okay. Senator Kimani, what should you do in terms of oversight for counties now? Because that's where you come in, and now every indication is that the war is in the county level. What should be the plan going forward? What strategy should they put in place now that you oversight the counties?
I think, Trevor, the better sense that should prevail on our county government leaders is first, that this is about the lives of our people. It's not about being followed and oversighted and asked where did you do it. This is not the time. I mean, just the human sense in us should be able to should guide us differently, and governors do what they're supposed to do. However, I believe now that monies have rolled to counties, that there should be also an initiative. And remember, in the Senate, we've had a COVID-19 surveillance committee that was formed. And I believe this is a responsibility that should scale down even to the National Assembly, whereby even the members of Parliament, because the primary role of Parliament itself in its totality is oversight. At this time, I think everybody needs to take responsibility. Trevor, it's very difficult right now to have a troop following the governors and the officers on a day-to-day basis. And that's why I said, just by the very nature of our law and how oversight is conducted, unless somebody has got in a sense, the responsibility to know that they have to do what they have been elected to do, it will be very difficult to oversight to effectiveness on the immediate. And so I think the better sense will prevail. However, this should also be a lesson, in my view, Trevor, that the way we've set out our laws, and especially on the process of oversight, is way outdated. It cannot work in today's sense. If we are conversing with you via Skype, why can't we also be more pragmatic, introduce technology? Besides the other innovative ideas as to how we would make oversight, an immediate thing. In Parliament, we've always complained that the oversight role now is played as though we are morticians. The way you go to a mortuary and your work is just to examine a body that died without having to offer any remedy before the death occurred, because oversight, as legislated now, happens after the act. Yeah, I've been a member of the Public Accounts Committee for almost 7 years, so I know this thing. I believe that we should review our processes to ensure that those that are mandated with oversight can participate in that process to keep their eye and control what they're supposed to control as the process proceeds. I know Governor Mutua is very well versed with this. So I believe we will also take responsibility, ensure that our people who've been given that mandate to do the right thing. Yeah. But like I've said, Trevor, most important is the better sense to prevail in every one of us, and especially people given responsibility, and know that it would be murderous. It would be unforgivable. After this, if you go to counties and find that the biggest loophole, that the biggest source and basket which has been looted will be the COVID-19 basket. I dread to imagine, but I can assure you, in some counties, that's exactly what you're going to find. That when some governors were given the opportunity and told, procure now as a matter of emergency, such that you don't have to follow all the processes and the bureaucracy, you will find, and you can put this somewhere in your in-tray and remove it when we speak again, maybe after about 3, 4, 5 months. This is going to be the story in many of the places.
All right. Let me show you. We're about to take a quick break here on Daybreak and come back with my guests and talk about how the health systems are right now. Can they handle the surge that we're experiencing right now as we speak? But for now, let me take you to CNN, I believe, show you what's really going on there. Just before we take a quick break right now, the still presidential election in the U.S. vote counting is ongoing right now. Biden has taken a big stride to winning the presidency. Trump is declaring fraud. We'll bring you some pictures there to show you what's happening right now. As it speaks, uncounted votes, that's in Arizona, 40% to 42%. 55% to 57% goes to Donald Trump there. That's what's needed to win. Uncounted votes are more than 500,000. As we speak, the electoral votes, about Biden has 253, Trump has 213. I told you there are about 538 electoral votes, and any candidate who's to win the presidency needs about 270. The first one to clock that means that they might be the president of the U.S. But even then, Democrat Joe Biden took a huge step, capturing the White House with the wins in Michigan and Wisconsin, bringing close to majority the possibility of him winning. But President Donald Trump responded with fury as his campaign sued to suspend the vote counting there. In a brief address in the national television flanked by American flags and his vice president pick Kamala Harris, Biden said he wasn't yet declaring victory, but that when the count is finished, he believes that he will be the winner. By flipping the northern battlegrounds of Michigan and Wisconsin, Biden reached 264 electoral votes against 214 so far. For Trump, by adding the 6 of Nevada, where he's narrowly ahead of the larger prize, he might be able to win. But the president, the incumbent president, is saying it's a fraud and is going to the Supreme Court to sue for his vote counting to stop, because he says that they were adding some votes that were not there initially. All right, let's take a quick break here. When we come back, we're still talking about the COVID-19 issues and the escalated or the slightly escalated COVID-19 measures. We're now going to talk about the healthcare systems. After all the funding, are they prepared to handle a second wave? That in just a bit.